so that we have all of our information as part of that.
Okay, so with that, welcome. This is the novel Coronavirus Outreach Training, a partnership between Public Health San Joaquin County and the City of Seattle. We're going to go around and do introductions of who is in the room. I'll start with myself as I'm talking. I'm Matias Valenzuela for the Coronavirus Response, the director of the branch that's in charge of community mitigation, or just basically stopping the spread of the disease.
And my name is Candace. I'm also, as part of the response, working with public health. I am working with community and faith-based organizations.
Hi, I'm excited to talk to you all today. This is Kirsten Weissen. I'm a policy analyst at Public Health Seattle, King County, and I'm working with businesses, including small businesses, on how to prevent the spread of this virus.
And I'm Janae Jan. I'm from the Office of Labor Standards at the City of Seattle. We're the office that administers a number of labor standards in the City of Seattle.
And I'm Carl Stickle with the Office of Economic Development with the City of Seattle.
I'm Tate Batch with the Office of Emergency Management and Public Education.
I'm Marguerite Papuano. I'm the non-pharmaceutical intervention specialist. I'm an epidemiologist, and I'm working with the community mitigation branch.
Hi, I'm Wang Wang. I'm with Department of Neighborhoods at City of Seattle, and I'm with the External Relations Division. We focus on community outreach and engagement.
Hey, what's up? This is Joaquin Wee. I'm with the Office of Immigrant and Refugee Affairs, and we are assisting public health in language access and outreach and education to immigrant and refugee communities in Seattle and King County.
All right, so this is hopefully an opportunity. A lot of you are doing work in the community, doing work with businesses, opportunity to provide you with some of the key information. There is a lot of misinformation or sometimes lack of understanding, and also the information is changing very quickly. So we're going to be providing up to the minute information here, and also be letting you know of how to continue to stay informed around this evolving situation. So in terms of the novel coronavirus, and the key thing around this coronavirus, because there are many coronaviruses, there's actually the common cold is a coronavirus as well, is that it is new. So we actually, individuals don't have immunity to it. So that means that a larger number of people than usual would be infected. And also it's hitting some particular populations particularly hard. So this is not as the level of mortality of this is not as high as SARS that we had in 2002, but it's still actually quite high. It's anywhere now from 2% to 3% of individuals who become infected end up dying. We'll talk a little bit more around this a little bit later. But it is a public health concern. It's been risen first. It started as a World Health Organization emergency, then it became US CDC and federal emergency. Now both the state of Washington and King County have declared this an emergency, because even though the numbers of infections right now aren't that high, the potential for it to continue to grow and spread is high. So that's why we are concerned, and it's really all hands approach to this. And also it's important, it's not only is it new and we don't have immunity, we don't have vaccines, and we don't actually have effective antivirals to treat it. So people who are sick, we don't have good mechanisms to address it. There is a lot of work now happening to actually develop those vaccines and medical interventions. But with the lack of that, one of the key things that we can do is actually take strategies as a community to address this particular threat. So really what this means, we're not going to be focusing in this session about the medical interventions, about investigation, those things. That there's a whole medical side of this, but I would say very critical to keep the spread low is what we can do in the community, what we can do. And also this is having some real effects in us in terms of businesses, in terms of families, in terms of community organizations. So we want to cover some of those impacts that this is having and how we can actually mitigate or address some of those issues. So what is the risk? And the numbers of cases, right now there's been a lot of emphasis on testing, number of cases. We're at a critical point here in which we actually have shifted from just tracking, we're still tracking individual cases as of, today we're now over 10 deaths within King County. We are over 50 cases in the county, but really more and more this is going to become those total number of cases. It's going to become less relevant because what we know is that there's really increasingly broad transmission in the community. So the numbers are going to grow and grow and grow. And at some point it's become less relevant to be able to track through the surveillance system because we're just going to know that it's going to be something that's going to be very quite widespread. So the more we can do to minimize that and protect especially those who are at highest risk is going to be extremely important. And that's where our focus is. Sometimes we have with seasonal influenza, sometimes we hear about very tragic deaths among children and infants. What we are learning so far about this is that it actually, the populations that it most affects are those in the older age population, so those over 60, those with underlying chronic medical conditions, those with a weakened immune system, and pregnant people. And fortunately in this regard, children have much less severe disease. So even though we're seeing increasing numbers, many people, we're saying probably about 80% of individuals have very little or very mild symptoms. About 20% have more serious symptoms, and in those most serious cases in which you have, especially with older adults and those with underlying health conditions, that's when you have hospitalizations and sometimes even death. But it's important to really keep in mind those risk groups and risk factors because that's where we really need to be focusing our attention and our energy.
And I will say just to that point, we get a lot of calls about folks asking if it's 60 and up with an underlying medical condition or if it's just 60 and up. And honestly, it's just 60 and up. If you are over the age of 60, it is a risk factor. So how does the coronavirus spread? Really, it's through the way that most typical cold and flu spread. It's by droplets. And so we're looking at, close physical contact, a person sneezing, coughing, etc., breathing close to another person, those droplets landing on your eyes, nose, or mouth, or you touching a surface in which someone has droplets on it, and then you touching your eyes, nose, and mouth. So really similar to the way a typical cold or flu can spread.
There's a lot of questions also in terms of how long does it live on surfaces, all of that. That's some research that is still evolving. Usually coronaviruses can be from anywhere from just hours to even days. So that's why it's important sometimes to disinfect.
And we've, to this point, we're learning that it actually could be up to 9 days that it lives on the surface. So if folks are asking that question, our Marguerite, our technical specialist, has fielded that one quite a bit for us. So tips to reduce the risk of spread. These are really important, and I think these are some of the things that we're emphasizing over and over and over again. One of the ways that we're going to reduce the spread in the community is for people to take personal responsibility around some of these directions. And what we know about communication in times of an emergency is that this really helps for people to get this from a trusted source. So as you all are working with community organizations, these are the key messages that we want to talk about. And when we talk about community organizations shifting the way they do services and maybe some of their protocols and procedures, really thinking about these steps as part of introducing these into their processes. So firstly, if someone thinks they're sick, please do not go to the emergency room. The first thing we want folks to do is call their healthcare provider. There may be ways that we can protect them from catching something else if they don't have coronavirus, actually catching it because they're going to an emergency room where people are sick, but also keeping other folks safe, right? Our healthcare workers are fielding a lot of questions right now, and folks coming into waiting rooms. It's just really important that we communicate to call their healthcare provider first. If folks don't have a healthcare provider to call, if they don't have a primary provider, they can call any one of our public health clinics, and they can get information there about what to do. Practicing excellent hygiene habits, so washing your hands, covering your cough. If you don't have a tissue, coughing into your elbow. And then frequently touch surfaces, cleaning them often. So the recommendation is that high traffic areas, door handles, doorknobs, railings, keyboards, cleaning those twice a day at least, but really often if you've got folks around those surfaces frequently. And obviously staying home when you're sick. If you are any sort of sick, to protect both yourself and other folks, stay home. Avoiding contact with people who are sick. So, you know, keeping the recommended distance is 6 feet. So keeping, you know, general space between you and the next person. And if you know someone's sick, you know, recommend that they go home, especially in places of employment. And we'll talk a little bit about that later with employers. Thinking about messaging really clearly around these vulnerable groups. So the groups that Matthias just went over who are vulnerable, that those folks are avoiding large gatherings, right? So large gatherings and places where people are in close proximity, we want to ask those folks to please avoid those spaces. And lastly, you know, stigma is a really big issue, and having misinformation spreads, you know, that can spread really easily. And so we're asking folks to stay informed by staying in touch with reputable sources. So that is our public health website, that is CDC, the World Health Organization. It's not, you know, your regular news outlets who sometimes, you know, may not get all the information 100% accurate. So what are the symptoms? They're, again, just like they spread just like the common cold and flu. The symptoms can look just like the common cold or flu. So fever, cough, difficulty breathing. Another one that Marguerite had brought up the other day was fatigue. And so thinking about how those may present, if you're experiencing any of those, again, please stay home. And if you think you may have been exposed, we'll talk about what to do. So people who've been diagnosed usually report symptoms in as few as 2 or as long as 14 days. And I understand 14 days can seem long, but that's what we're experiencing with this particular virus.
So one of the things, the 14 days is important because when we talk about self-quarantine, we'll talk a little bit more about that. And that's what we're basically seeing is putting people in a place in which they have to monitor their symptoms. 14 days pass. If they're actually not sick at that moment, then they can go about their regular lives.
Thank you, Matthias and Candace. This is Kirsten. I'm going to take you through 3 slides. We'll start with who should seek medical evaluation. This is very similar to what Candace just said. If you have symptoms, fever, cough, or shortness of breath, try to call your healthcare provider. Please, for the sake of the emergency room and for the sake of your own health, stay away from emergency rooms. If you don't have a healthcare provider, you are free to call one of our public health centers, and their phone numbers are listed at our Public Health King County website. A little bit of context. This is a virus to which none of us has immunity. There is no vaccine and there is no tailored treatment. So if you are having mild symptoms, and we know 80% of people have mild symptoms, even your healthcare provider, when you get through to them, could well be telling you to stay home for 14 days and take good care of yourself as you would with a flu. So just, we have new information for what people who test positive, people who have come into contact, and people who have symptoms and are concerned should do. Clearly, as always, a lot of what we're saying to you today is what we always say to you as the Public Health Department, including washing your hands regularly. If you are having a medical emergency, do what you always do, which is call 911. Our ambulance service is prepared for coronavirus, for COVID-19. They know what to do. Please let them know if you suspect that you might be contagious, but they are very practiced and adept in responding to this virus. If you are in King County, one thing that Public Health does is we carefully record everybody who has this virus so that we can predict how many people might get it into the future. We have a phone number. It is 206-477-3977 that you should call if you believe that you were exposed to a case of coronavirus, I'm going to say the phone number one more time for those on the phone. It is area code 206-477-3977. Again, all of these numbers are at our public health website, which is www.kingcounty.gov/COVID, COVID. We do know that our call volume is very high right now, and they are working as fast as they can, and more people come into the call center every day, but thank you, and we apologize for the wait lengths on the call center right now. Public health throws around a lot of terms that are sometimes hard to understand, even like coronavirus, but I do want to take a minute to tell you what the difference is between isolation and quarantine. Isolation is the separation of people who are currently sick, and they are very able to spread this virus to another person if they are within 6 feet through our small droplets from our mouth or possibly from surfaces. So if you are sick, you benefit everybody, including yourself and your loved ones, if you isolate yourself. It's kind of strange to stay home for 14 days and not go out, but that is what we are doing all around this planet to combat the spread of coronavirus. A second step is quarantine, and this is people who have not currently shown symptoms, but they know that they are at increased risk for having been exposed. So they are also asked to stay home often for 14 days, even though they might feel perfectly well, but they just are one of these mechanisms that can potentially transmit the virus to somebody else. So that's the home isolation, and home quarantine is better off for you and your health because you're not coming into maybe multiple exposures to this virus if you go into the hospital or even if you go into your doctor's office. So home is, keep it really clean, bright and clean, is a safe place for people who have been exposed or who are experiencing symptoms. And again, the grace is that this is often a mild illness, and it is especially mild for young people and children. Next slide, please. As you all have seen on the news, the coronavirus started in Wuhan, China in December of 2019. So we have all seen and are able to track that some countries have higher virus in the community than others. And we have seen China and Iran with high spread transmission, South Korea, Italy, Japan, Hong Kong. It's kind of common sense, maybe not to travel to these countries right now in the month of March. But I also want to mentally prepare you that we probably are getting contagion of the virus from people who live in King County and the Seattle area, so travel is not our top concern at the moment. Next slide.
All right, so now Seattle King County area has really become the epicenter for this in the United States, although now we're seeing a lot more transmission in other parts of the country, like California, for example. When this epidemic first started, most of the cases were coming from China, but now they may be coming from other countries, they may be coming from other parts of this country, and even there's been cases now in which we've known in which there's somebody from our region that's been spreading the virus in other places. So we are still early in this epidemic, and we are really at quite a critical time. And that's why some of the steps that have been taken, especially this week here in King County, we have been really the first place in the nation that's taken steps like this. And it's really because we want to take aggressive measures to really, in essence, save lives and protect our community. We want to, if we were to continue to actually do kind of business as usual, we probably would see a similar situation that happened in China very early on before they took very aggressive measures. So we've actually been taking some things to really diminish in terms of that curve, in terms of how many people are going to be affected. We're going to be talking a lot more about this later in terms of details, but just given where we are at, that's why it's important to really stop that kind of upward trend in cases. It's still going to continue to go up, is what we expect, but we want to just diminish how much that curve goes, how steep that curve is. So it's really important right now to plan for what to do if many people become ill. So most of this webinar is focusing on some of those things, is how to keep your organization running if employees are sick, or if children can't go to school or childcare, and also what we can do to encourage plans for neighbors and friends to help each other if someone is sick. So critically important, and this is where we all become part of this, public health is one player in this. Here we're partnering today in this webinar with the City of Seattle, but I know many other cities and organizations are on this because we have to be doing this work together. And the more that we can actually share some of this information to really provide people and arm people with what they can do themselves at the individual level and at the community level, at the organizational level, we're going to all be better off and reduce the impact that this may have, because we know, and that's one of the things that we're always challenged with here in public health, is thinking about both the human cost of this, the economic cost, and really trying to walk that fine line and say, okay, what are the best measures to take? So a lot of the things that we are considering, that we are actually putting out as guidelines, are not taken very lightly. We do it with a lot of considerations. We understand the impacts. Just so you know too, we're not flying alone on this. We are working, we have CDC on the ground here. They arrived on Saturday, and they're continuing to provide backup, because some of the things that we're doing here and what we're learning and what we can do to actually stop the spread in our community is going to become basically the template for what's going to be done in the rest of the country. So the situation in King County, as I was saying earlier, we're seeing a growing number of cases. A lot of what we've been seeing this week in the news is a very tragic situation in the nursing facility in Kirkland. It's gotten national and international attention. Very tragic. A lot of older people with underlying health conditions as well, but then other people being exposed as well. And they're also, really importantly, is now we are seeing increasing amount of spread in the community. And we don't know yet, and there's really no way to know the full extent of how wide it is. Fortunately, we've been able to now, just in this week, as part of this, when the week started, all the testing had to go to the CDC, and there was really a backlog in terms of how much we could test. Now the CDC is doing testing, but also our state lab is doing testing, the University of Washington is doing testing, and there are other ways of doing testing. So we will be able to get a much better sense of this now in terms of, and then who actually has coronavirus, because that's been a limitation on this. So even though I said earlier, we're in the 50 some odd, almost 60 cases in the county, the number is actually significantly higher. We just don't have a complete grasp of it at this moment. Some of the things that we have done is, and I mentioned this earlier too, but we proclaimed an emergency. Other jurisdictions have done this as well. This just allows us to mobilize resources. Our city partners here, they have their emergency operations center going. Others of you in your cities have that happening as well. Here, just public health, South King County, I would say we easily have in the hundreds of people working on this response every single day here. And we're actually really gearing up for the long haul. We're thinking about this not in terms of days, not even weeks. It's really thinking about it in terms of months. So we'll be providing more information in terms of how to continue to get updated, but it's really important to continue to track the changing situation. In terms of what public health is doing, kind of a lot of this some is really the bread and butter of public health, but it's really been ramped up. We have a communicable disease section that really does disease surveillance and investigation. So a lot of the contact tracing, a lot of the testing, a lot of just the follow-up on individual cases is very intensive work. people have been strapped. That's one of the areas where we have gotten more support to do more there. But that's a significant part of the work that we do. We're also been coordinating all the work that happens around isolation and quarantine. In general, Kristen was talking about how the definition of isolation and quarantine, people have been doing this on their own generally, although King County does have, or the health officer does have, if there's somebody not cooperating, they can actually take some emergency measures and actually order this. So we're not only asking people to stay home or those who are positive cases to be isolated, we also have to make sure that they have the support that they need. And this is something that for city partners, especially, and other community organizations, this is something that we need to be very conscious of in terms of how do we serve and support those individuals, those increasing number of individuals who are going to be quarantined, and to make sure that they have their basic needs met, that they have food, they have the necessary water that they need, their financial needs met. If somebody can't go to work, what does that mean for them? So there's a lot of issues around this, and very importantly too is just the equity considerations as we do some of these things. And those many people are sometimes just one paycheck away from potentially being homeless or not being able to pay the rent, those kinds of things. So this really should be an all hands on deck approach. And how do we support those people that are actually being most affected by this? We are disseminating a lot of messages and materials. We'll cover a lot of the things that we've done, and also in many different languages and in many different formats. And also engaging with communities who might be most impacted. Here in our next section, we'll be going through how we've defined some of these communities and different groups that we have in public health, working with them. But we want to make sure that we are able to support, provide appropriate information to those particular sectors who are being most impacted.
Great. So I'm going to talk a little bit about how we are set up and what the structure is that we're working under. And that'll give you all a sense for how to connect with us and how to kind of field questions that you all may be getting as well. So there are a whole, like Matthias said, there's a whole group of folks who are focused on clinical stuff and thinking about isolation and quarantine and wraparound services. And then there's a great need for us is to think about public health more broadly in the community around how services are continuing to be provided and where there might be gaps or where there need to be nuances in the interventions that we talked about. So we recognize that, for instance, when we stay 6 feet away from the person next to you, we get a lot of questions about, does that mean we need to close services? Are services mission critical? We do feeding programs. So if you look at the structure on the screen in front of you, you'll notice, for those of you who aren't able to see, I'll just walk through this a bit. So there is a community mitigation branch director. And let me just say, these aren't terms we're using external to the public because no one really knows what mitigation or community mitigation means. Basically, what we're doing is we're employing things that will help stop the spread of coronavirus. So we have a branch director, that is Matthias. Matthias has a deputy support person that is helping think about all of the other kind of high level things that come up. Underneath that structure, there is what Marguerite mentioned. She is our non-pharmaceutical group intervention specialist. And so helping us think about how we apply these interventions throughout all of these various sectors. We have a houseless sector. So we're thinking about people who are not sheltered and who don't have housing. They are very deep in that work. And I will just let you all know that we are relying on people who do this work on a day-to-day basis. And that is the case with most of these task forces. We are integrating with folks who are already working with folks who are unsheltered right now. They have the expertise, the knowledge, and the understanding, and they're coordinating with our clinical folks to understand how to shift some of their work and guidance to best support our community in that way. Kirsten Weisen, who you heard from and we'll hear from again, is supporting our business task force. And right now, from an equity perspective, it's also really leaning heavily into small and medium-sized businesses. As Matthias talked about the economic impacts that are taking place, Kirsten is fielding a lot of questions around that and trying to support businesses the best way possible. We have a children and youth task force that is connected at all levels of government, that is also thinking about how we're supporting young adults and K through 12 folks, as well as childcare. So we're thinking about the entire span of children and youth in that, as well as programming that goes with that. We have someone focused on our government task force, which is a really tall order, but thinking about government all the way from federal through the local government and thinking about folks who are within cities. I believe we have some folks represented on this call from cities. And so, we have a government task force rep who's thinking about how you're getting information, how that's connected to our King County Emergency Operations Center, and making sure there's fluidity in how we're talking to one another. I am focused on community and faith-based task force, which is community-based organizations, community leaders who may not quite be a 501c3, but are out in community providing services, and faith-based organizations. And we recognize there's a lot of overlap in some of these task forces, and so we're in close communication. We meet often, we're working together at the same tables, and so we're helping each other kind of field questions that come across. We also have a team that's focused specifically on behavioral health needs because of some of the stigmatization that's happening, as well as some of just the isolation that occurs with something like this type of event. And then lastly, we have a speakers bureau, and those are folks who are trained to kind of give presentations like this, who can go out and talk to groups, who can run webinars, who can field questions, and who are also trained to work in our call center.
We also have a pandemic community advisory group.
Yes,
and
thank you.
That's a group that we convened for the very first time this week. It's community leaders, sector leaders. It's also from large businesses, from smaller businesses. It really cuts across, and many times these are also the connectors. So key people as part of coalitions or networks that are helping us get the information out, but more importantly, actually telling us what are the issues that are surfacing for them, what are the needs that are surfacing for them. And then also we have tended to be quite reactive in the sense that we're just trying to respond to what's happening. But this is an opportunity to think about, okay, what can we see, what should we be thinking about for next week and the week after that, to actually be getting a little bit ahead of the curve. One of the things too, just to give a flavor of this, how it plays out, this is in each of these groups, either the group that Candace leads or the one that Kirsten leads, where there are many events, for example, that are considering what are they going to do this weekend, or what are they going to do as a business, and should they stay open, and those kinds of things. This is a group that provides guidance, and we have people like Candace and Kirsten that really work providing technical assistance in terms of, okay, what is the best recourse to take.
Yeah, and I'm happy to put out my information, some contact information. If you have questions, as task force leads, that's exactly what we're there for, to kind of help with the nuance. And sometimes it's just a reassurance that you're doing something right, or is there anything you need to add? And we're happy to field those questions. So this was actually really early in the response. We were fielding a lot of questions around stigma and bias, and I can't say enough from a social justice perspective how racism is a public health issue, and we are doing everything we can to speak out against that. If there are strategies you all have that you're considering that you feel would be helpful for us to employ as a public health department to help reduce stigma, bias, and racism around this, please do speak up and let us know what those ideas are. We are hearing everything from, people being asked to leave spaces on the account that people think they're sick or assuming they have coronavirus, and that's just not something we stand for. There are mechanisms to report this. At the state level, those are on our website. If you go to the bit.ly link that's on this page, you can find those resources. You'll see some places that you can go at the state level to report discrimination in housing, in workplaces, in various sorts of public settings. And then these are posters that you can print out. So you're welcome to those. I believe we may even have files to send to you if you want to print mass print them and put them up in your places. And again, if you have any ideas around this that we're not already doing, please do let us know. We're happy to support.
Yeah, one of the things early on, the focus had been particularly on the Asian Pacific Islander community. It's not just about putting materials up. There's a lot of misinformation that is out there. A lot of things that we've been hearing sometimes on social media, and it's not just kind of Facebook and Twitter, but also apps like WhatsApp and others. So this is where it's critically important to be able to address very early the misinformation that is being spread. We even have been out to many businesses or gone to places, for example, in South King County, to have a presence when we hear something we want to actually address. No, this is actually a rumor. There isn't such a case here, or whatever it may be. We also know it's been important, for example, the mayor of Seattle being in the International District, Chinatown area, just to support the businesses. We've seen and heard of pretty significant impacts on businesses, so it's critically important for us to support them. Also, I would say early on also there's been a lot of stigma, bias, and racism focused on particular groups. Now what we're seeing also as we're setting up throughout the county and in the city of Seattle isolation and quarantine sites, especially for those who are houseless and homeless, is really some bias and discrimination against those individuals. So I think it's really important for us to just continue to be united in addressing those issues as they come up.
And I would just remind folks to take a stance of compassion. We definitely understand there's a lot of fear and panic out there, and if folks are end up being encountering the coronavirus and end up getting sick, those folks, we have to remember those folks are already going to be isolated. They're already going to be physically ill. There's no need to add to the mental health and emotional component around that. Let's remind one another to please be compassionate. These folks need our support as much as possible. So what are we doing? And Matthias talked about this a little bit, but what are our strategies for reducing the spread of coronavirus? This is really about, like we said before, promoting these personal strategies. So, expressing to people that it's important to stay home when they're sick. I think we have a culture in this country of just go, 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 work, work, work. Everything is urgent. This is an opportunity to reverse that a little bit. And to remind people to slow down. There's a lot of things that are not life critical, that are not mission critical. As much as you can stay home and slow down in this environment, please do. Hand washing, when we say respiratory etiquette, right? Just coughing in your elbow, using a tissue, throwing that away, just reminding people verbally about that. Putting up signs is great. As much as you all have connections with religious leaders, faith leaders, community leaders, elders in the community who are looked up to, who are trusted, remind them to verbally talk to the folks around them about this. Environmental measures. So this is routinely cleaning off surfaces. And when we say routinely cleaning off surfaces, this is at least twice a day. So, wiping down with a disinfectant, not drying that off afterwards, but letting it air dry. So using those wipes appropriately, there's instructions on those. People often wipe them down and kind of clear up the wetness with a paper towel, let it air dry. So routinely cleaning off those touch surfaces. Advanced planning for social distancing. So, and this is where Matthias talked about us kind of helping folks think about what's essential, how to make those spaces safe for folks, but really creating as much space as possible between people. So we talk about if you have a practice, for example, of greeting someone at a door, maybe don't, right? Maybe think about creating a table where behind you could have your staff behind the table and people coming through, so that you're creating a barrier or some distance where you can speak to people, but maybe not shake their hands or hug them. Reminding people, putting up signs, this is a hand-free or hug-free space for the time being. And thinking about how we can message some of that. Any ideas that you guys have or are coming up with about how programs and services need to be shifted? We're fielding those frequently, so do feel free to send us those questions. And then talking about engaging sectors. So that's part of the work we're doing with you all today, just thinking about how we can prepare. We have some really great resources online for both for-profit and community-based organizations to start thinking about what it would mean to prepare. So questions about staffing, questions about supply chain management, questions about how you would communicate with your staff and with your with the people you serve around how you're shifting your programming. You know, how you guys are working with one another. I think in times like this, it's important to think about how service providers can actually support one another in different ways and think about the populations you serve as more of a collective. And so we have some resources and tools for you all to think about that, and we're happy to send those out as well.
Thanks, Candace and Matthias. This is Kirsten. I'm going to go through 2 slides and then we'll turn to our first session of question and answer. And there's some very interesting questions coming in on the chat box. Thank you for all of those insights and information and ideas. On March 4th, which was Wednesday, our public health department made some recommendations in the interest of reducing the spread of this virus in our region. And to protect their own health, we are recommending that people who are over 60, people who have underlying health conditions, people who know they have a weaker immune system, people who are pregnant, we recommend that you stay home. And we recommend that you avoid large groups of 50 or more people as much as possible in the next 3 weeks. We are recommending that employers acknowledge that this is a very unusual time for us, and we are asking employers to take steps to offer very flexible sick leave and telecommute options and to minimize close contact with large groups for 3 weeks, and that is for the month of March. Next slide. We are recommending, but we are not requiring, but we are recommending that if at all feasible, consider to postpone events and plans that you have to bring many people together. We really want people to stay 6 feet away from each other if at all humanly possible so that they avoid transmitting the virus. And if it is necessary to bring people together, we are asking you to take precautions to minimize the risk of spreading the disease. People aren't maybe so close to each other. They have a good reminder and a good easy way to wash their hands. They are covering their coughs and their sneezes. This is really, you know, what your mom told you to do, or your dad, or a loved one when you were small, and what our public health department always tells you to do to avoid the flu. But we're telling you right now that our whole entire community is going to benefit if we, as Matthias said, we have not a big spike of a lot of people getting this virus, but a smaller, slower increase so we can all adapt and so that we protect the health of our older adults in our community and people with underlying health conditions. We are asking you with great intention to practice your healthy habits. Number 1 is to stay home when you're sick so you're not transmitting possibly that virus to anybody else. Wash your hands. It seems like I always want to touch my face these days and touch my eyes, but the virus enters through our mouth, through our nose, and through our eyes. Anything that we can do to avoid touching our face because we possibly have touched a surface with virus is to be recommended for at least the month of March. We are not recommending to close schools right now. This might seem a little bit counterintuitive, but our best epidemiology experts believe that the virus will not spread as much when schools are open. Children almost seem to escape catching the virus, and if they do, it is a very mild illness. Almost always. We have experienced, this is our 8th large outbreak in the last 10 years between H1N1, SARS, Ebola, MERS, and Zika, and we know that when we close the schools, some things that we might not expect happen, such as our wonderful young people just meet up at the mall and they transmit virus as much as they would have anyway. And we are also pulling people, parents and guardians out of the healthcare system. So we are protecting our healthcare providers to the best of our ability and really trying to reduce the spread of the virus. All of our recommendations are based on the science of how to diminish the spread of viruses. We have a lot more information online, and for those on the phone, that is kingcounty.gov/COVID, COVID.
And I just want to make one quick clarification. I normally am following this. We're going to do Q&A, but I want this piece of this to be on the recorded call. So Amanda asked a question about the 10 that was on the press conference versus our recommendation of 50. So there was an internal conversation immediately following that press conference in which the decision was made to revise that number to 50. So I just wanted to make that clarification. For now, that number has been revised to 50. And at this point, we're going to pause the recording and we're going to go ahead and we'll go back and we'll answer some of the questions that folks asked. Some of the rest of these slides will address some of the questions that you all have.
Yeah.
So we've talked a lot about how organizations can respond to the coronavirus, but there are some very important things that you can do as an individual. This kind of personal preparedness is just something that we all need to think through. How are we going to get through the month of March? It's going to be a very different month than we thought we were going to be going through. Some people are going to have to decide, the schools are open now, but we are all doing what ifs. What if the schools have to close? Again, not certain, but it's possible. Think as much as you can about how you would work from home. Be ready to lend a hand to your neighbors who may not have the information that you have and may have fear. Doing some drop-offs without having a big hug and a kiss is a nice thing to offer to your neighbor. Phone calls, email check-ins. Even in our own homes, they're going to get all spick and span as we clean our frequently touched surfaces. It is important to have some extra supplies on hand so that you can be self-sufficient, and for your own sake, if you don't have to go out in the middle of a period where we know there's a lot of virus, you are going to be better off. Please do reach out to think about the people in your circle who are at greater risk and what we can do to support them. Maybe you want to get to know your neighbors a little better. And talk to your employers, and if you run a business, think about sick leave policies. Next.
Hi, this is Tay from the City of Seattle Office of Emergency Management with the Public Education Team. And what you see in front of you is an infographic that we use a lot in our outreach. This infographic provides basic preparedness guidance intended to help people prepare for all hazards. The most likely impact from the current coronavirus situation is that people will be required to stay home for up to at least 2 weeks if they are ill in order to limit exposure. The list of supplies that you see on the first page of the infographic are things you should think about having on hand to help you get through the 2-week period. Some important items to point out are obviously water, food, medications, and medical equipment. We have these in multiple languages. We have them in about 10 different languages. So if you do outreach to folks whose first language is not English, we'll be sending them out to you all after this webinar. Even more important, as Kirsten mentioned, is getting to know your neighbors. And particularly, this includes encouraging people to, know your neighbors' phone numbers, kind of if they have underlying health conditions, if they need more support. Have phones and emails for those people so you can check in on them regularly and offer support in the event that they do have to remain at home. Next slide. In the next slide, we have information on Seattle and King County's notification system. This is a free service that you can sign up to get timely and relevant information around any major alerts or announcement that the city or the county is putting out. You can choose to get the alert via text, email, or phone call. So far, our capacity is only English right now. We understand that that's a gap, and we are working on that. This information is also on the infographic for Seattle, for Alert Seattle as well. Even if you don't live in Seattle or King County, but spend a lot of time here for work or pleasure, we recommend that you still sign up for this.
We talked a little bit, this is Kirsten again, and I am doing the business task force, so we'll spend a little bit of time for what employers should be doing. And this is a recommendation, not a requirement, but we recommend that all employers, most important is if you have an employee or you yourself are sick, again, is to stay home so you don't spread that virus. If someone comes to work and they are sick, they should be separated from other healthy employees and given a safe way to get back home and stay home for the 14-day period. Cover your cough, wash your hands, clean your surfaces. There is some travel, just be aware of how widespread coronavirus is in a place that you may choose to go. Many employers are not allowing non-essential travel for their employees. And just, this is hard enough already, but if you can imagine what would I do in 2 weeks or 3 weeks or in 2 months if this thing took a turn for the worse, whatever you can think of today, you're going to be happy that you might have done.
So there was a question earlier about community-based organizations and what we're doing and contracts with both King County and City of Seattle. So I want to offer this up. There is a link, and we'll make sure this is posted in the comments as well as sent out afterwards, but this is an entire guidance document that walks you through each of these standards to help you identify your essential functions, to think about some of the pandemic planning that Kirsten mentioned, and it's really tailored toward people who are providing services in our communities and small businesses. So I really encourage you to take a look at this. It asks you some very specific planning questions. Get with your agency staff and think through some of these questions. And this is also a point to when you find gaps, reach out to myself and or Kirsten around some of those questions. And I will also say for those of you who are working, who have contractors, who have grantees, who are working with people, we are encouraging folks to provide as much flexibility in deliverables as possible. So if those deliverables do not include life supporting, mission critical type things, please do provide as much flexibility in your contract deliverables as you possibly can. Think about, extending deliverables, allowing people to continue doing what they need to do without losing pay, and then making up for those things as we move through this event. And then this is just a sample of business guidance. So just thinking about, medium to larger size businesses, this is an opportunity for folks to kind of think through this. This is kind of a quick and dirty. This is about 3 pages. It's also on our front page. So both the planning guidance for medium to larger businesses, as well as community-based service providers and smaller businesses, is on our front page under the headline workplace and employers. So if you click that drop down, you'll see all of those resources listed in links.
So now we are going to pause the recording once again, and we're going to take questions as you type them in.
Great. So there we go. So this is in a really interesting place on our website, so I just wanted to make sure that we are highlighting this, that there is a Washington paid sick leave, there is Washington paid family medical leave, there is a City of Seattle paid sick and safe time, which City of Seattle folks can walk you guys through. And then there is some guidance. We've gotten some guidance from folks in various city jurisdictions about how to handle pandemic preparedness in the workplace from an HR perspective. Those laws intersect really specifically, and there are privacy and protections around people's health information that are important to be aware of. This is from our HR folks. This is kind of the best guidance that intersects some of that. So take a look at that Equal Opportunity Employment Commission link on pandemic preparedness to support you there. And if you're looking for this, this can be found, if you go to our anti-stigma resources, you'll find this as the second section once you click on that page.
All right, everyone. Again, my name is Janae Jan. I'm from the City of Seattle Office of Labor Standards, which is the city department that oversees the City of Seattle's paid sick and safe time law. I'll pause here and note that, as I mentioned before earlier, that there is a Washington State paid sick and safe leave law that the Washington State Labor and Industries folks oversee. So just note that while I'm going through this, that this is the City of Seattle law. While many things are similar, the employees who are covered are a little bit different. So for folks who are working outside the City of Seattle, you'll want to go to the state website, which is lni.wa.gov, for more information about the state law. But in terms of the City of Seattle, I'll dive into a few details about the law. As our partners here in the room have kind of indicated, both employers and employees can play a part in keeping the community safe by ensuring that employees use their paid time off. So the Seattle law requires employers to provide employees who work in Seattle with paid time off to care for themselves or a family member for a physical or mental illness or health condition or injury, to go to the doctor to get medical or preventative care. If their place of business has been closed by a public official for health reasons, that would include folks at Public Health King County, CDC, Washington State Department of Health, or a superintendent of a public school, for instance. Also to provide time off if their child's school or place of care has been closed by the same kind of folks. And then also when individuals are recommended by public health officials to self-quarantine. We understand that employees and employers are going to have a lot of questions about the paid sick and safe time law as they're preparing for the impact of coronavirus, of COVID-19. So it's important to us that employers and employees have access to that information that they need to be successful in applying this law. So we won't cover all of the details, but I do want to point you in the right direction for our resources. So we have a couple of new things. Our team has created a new 2-page paid sick and safe time and COVID-19 frequently asked questions. So these are a number of questions that have come up for our team over the past weeks related to COVID. Those are going to be on our website, and we are currently translating them into 11 different languages. I know there's a note here that says our fact sheet is also going to be available in 8 languages. We have upped that to 11. So those are going to be posted on our website, rolling as they come in. So if you're interested in knowing what those languages are, it's going to be Spanish, French, Simplified Chinese, Khmer, Korean, Somali, Tagalog, Vietnamese, Amharic, Tigrinya, and Oromo. So those are going to be for both the fact sheet, that 1 page that you see there on the screen, as well as the 2-page Q&A. I'll also note that we have a comprehensive question and answers document that is everything you would want to know about paid sick and safe time and complying with that ordinance or accessing the rights of that ordinance. It is quite lengthy. It's about 40 pages, so don't be alarmed. There are questions in there that I would suggest find on the computer to find those questions. But the other thing too, if you're overwhelmed by that Q&A, we have labor standards engagement specialists who are ready to answer questions by email, phone, or the web. So our phone number is 206-256-5297. And that's 206-256-5297. The email there on the screen, which is laborstandards@seattle.gov, is a good way to get in touch with us. We triage, so if you're an employee, you'll be sent to our enforcement team, and then for employers, you'll be sent to our business engagement specialists. So we do encourage folks to ask those questions that you have. We want to make sure that you have the information to be successful. I know in this time where folks are stressed, We want to make sure that you're set up for success in the future. So please reach out to us if you have questions. I'll also note, and it's not on the slide, there is one other ordinance that may be of interest to some employers and employees of big retail and food establishment locations. That's the secure scheduling ordinance. So that's one that it provides kind of stable, secure scheduling for employees who work in those covered businesses. So we also have information about that one. There's and I won't get too weedsy on this, but there are some details related to schedule changes that might be helpful to know. So we're going to post some more information on our website on that specific secure scheduling page that should be helpful as well.
Great. We're going to continue to go through how to get continue to stay informed, and then we'll take another round of questions. So as we've been talking about, I think both the issues around also kind of labor and other things, those are changing as well, but especially around coronavirus itself. It's important to stay informed. We've seen just in the last week many new developments. We have had press conferences pretty much every day here in our offices. So it's really important to continue to stay informed. You can go on our website, which the URL is there, or if you're on the phone, it's kingcounty.gov/COVID, COVID. We have common questions based on different audiences, depending on what information you're looking for. We have information in different languages. Call center information, we both have a King County and in Washington State Department of Health call center, helping you whether you have illness questions or other types of questions. And then information on when and how to seek medical evaluation and advice. That's important. A lot of people asking, what should I do now? I am sick, or I believe I was in contact with somebody who I think had coronavirus. What do I do? The blog that we have there, publichealthinsider.com, is also a great source of information, providing a lot of context, rationale, and guidance. For example, in this webinar, we explained why the steps we've taken around children and schools, and why we haven't recommended, if in the case when there isn't a case in the school, to close schools more generally. Those things can, we are explained in more plain language and with rationale in that blog. And also the City of Seattle has welcoming. Well, Joaquin, do you want to mention a little bit around the information you have?
Yeah, we have been preventing with our partners. This is Joaquin with the City of Seattle Office of Immigrant and Refugee Affairs. And the City of Seattle and King County and other municipalities have been preparing for this since January, since we first heard about the outbreaks from in other parts of the world. And as soon as we got the confirmed diagnoses of COVID in Washington State, and which happened to be the first in the US, we quickly activated to help each other out with things like language access and making sure that consistent public health recommendations are translated in some of the top languages. We take translation very seriously, so it's hard for us to quickly turn around the translation of documents because they go through an initial review of the English version, and then that gets translated and that gets reviewed again. As you can imagine, we take warnings and recommendations and tips about public health and about COVID-19 very seriously. And we're also in communication with ethnic media outlets that report on news and information for immigrant and refugee audiences all around Seattle. And we're in communication with them about making sure that they're in the know about the coordination that we're doing with our friends at Public Health and also our friends at the state level and at the CDC.
Thanks, Joaquin. So other ways to stay informed, you can follow us on social media at KCPUB Health on Facebook. And then for those who are looking at the slides on the webinar, that's actually on the wrong date. It's on Mondays. So on Mondays at 4 o'clock, we have a partnership call. So it's open to Anybody who wants to call in, this Monday, seemed like a long time ago, we actually had over 200 people listening just on updates about what's happening. Call 206-263-8114, and the code is 560794. And it's also like this one offered as the Skype as well, and we will share any slides with developing information. So that's just a great way to continue to, we provide information, and similar to now, just answer questions as they may arise. So we will be.
I just wanted to say really quickly, because we may have a shift in technology that allows us to provide more space on that call. We were kind of bumping close to our limit on the call for that piece of technology. So right now the number is 206-263-8114. If you're not getting those calls and you'd like to, and you happen to be on the chat box, please, you can put your email in the chat box and just say add me, and I'll make sure to put you on the Skype call invite. That number may change, so we want to keep folks updated, and we will be shifting, we'll send that out once we shift that. The other thing you can do is you can email the phpartnerships@kingcounty.gov email if you want to get on that. At this point, we are going to shift to the Q&A. Go ahead.
Yeah, and the other thing we'll just say is we'll be, this information will be posting both the webinar itself and some of the materials we've been talking about, and the PowerPoint as a PDF on our website, and sharing that to folks that we have contact information. And also it's going to be available on our coronavirus website.
And one last thing I wanted to say about the call is that we are also trying to really prioritize community partners, especially smaller community partners who may not have access to information. So if you are connected to those folks, please do share the invite. This isn't just for government folks or program managers or city human service planners. This is really an opportunity for our small community-based organizations to speak up and share what they need. So if you have folks, please do invite them. At this time, we are going to shift to the Q&A portion of the session, and we're going to stop the recording and we will unmute the line. So just one piece